Menstrual disturbance usually happens to older women, and it can be frightening, but also it can be a sign of health problems if it happens to younger females. When menstrual disturbance is caused by some underlying condition, we usually expect to see other symptoms. And now I want to talk about one other symptom which indicates that the cause of menstrual disturbance is adrenal hyperplasia. This is the adrenal gland. This gland is responsible for production of different hormones, and it also produces testosterone. We usually think of men when we talk about testosterone, but yes, females also produce testosterone, and they do it with the help of this gland. This gland also produces cortisol, that is the stress hormone. And during cortisol production, an enzyme called 21-hydroxylase plays an important role. A mutation of genes coding for this enzyme can result in an enzyme defect, and if that happens, the hormone we just named, cortisol, cannot be produced sufficiently. Usually, the human body tries to compensate for these defects or somehow bypass them. In this case, an organ found inferiorly to the human brain, the pituitary gland, produces a hormone called the ACTH. ACTH stands for adrenocorticotropic hormone, and it stimulates the adrenal glands to produce more cortisol and also grow in size and become larger. This growth of the adrenal gland is called hyperplasia, and therefore this condition is also called adrenal hyperplasia. And while this way the body is trying to compensate and produce more cortisol, the larger adrenal gland can also produce more hormones such as testosterone and 17-hydroxyprogesterone. These hormonal disturbances then result in menstrual disturbances. Furthermore, it causes an increase and an abnormal hair growth in females. Humans have adrenal glands on both sides of their body, and right underneath these adrenal glands are the kidneys. This enzyme defect in the adrenal glands not only affects the genitals and hair, it also affects kidneys. Adrenal glands produce a hormone called aldosterone, and this hormone helps the body keep more water and sodium in the bloodstream. This is done in kidneys, and that way the body can regulate the blood pressure. This defect of 21-hydroxylase enzyme not only prevents the proper production of cortisol, but also aldosterone as well. And therefore, because the patient lacks aldosterone, all the water and sodium from urine cannot be reabsorbed into the bloodstream. By losing sodium and water, the fatal and dangerous salt wasting syndrome can happen. So not only can this condition cause menstrual problems and problems in relation to visual appearance of the patient, it can also endanger patient's life. Diagnostics for this condition and the interpretation of diagnostic results should only be performed by a competent and an educated professional. Both of you, doctors and patients, we have something for you. If you're a doctor and you want to make videos like these, then go to anatomsky.com. But if you're a patient and you have more questions about adrenal hyperplasia, then go to symptomsky.com/help/adrenal-hyperplasia.